Hi, so I'm Rebecca Steinfeld. I'm the Head of Policy at National Voices. I'll be co-chairing this webinar this morning together with my lovely colleague, Rachel Matthews, who is our project manager. Now, we planned this webinar long before the recent announcements about lifting lockdown, and in particular, last Saturday night's news that those who have been shielding can now resume some outdoor activity. But we're obviously very pleased that we scheduled it in because there's a lot to talk about. And a lot of interest from you. There are more than 150 of you who signed up to join us on this webinar today. What we're planning to do is to try to create as interactive a space as possible for you to really air what your thoughts are, your feelings, your experiences about the lifting of lockdown. There's lots of different roads we thought we might be able to go down. I'll mention a few, but this is by no means prescriptive. We want to know how you're experiencing the announcements. If you're a person who's been categorised or who sees themselves as vulnerable or extremely vulnerable, whether you feel confident or you feel confused about the announcements and the guidance, whether you're happy with the way that the changes are being communicated, what specific concerns you might have about things like returning to work or to school or using public transport, or about the impact on the volunteer programmes that have been set up to support you to access food or medicine as people return to work. If you're a voluntary sector organisation who's joining us today, you may want to tell us about the impact on your advice services of recent changes, whether there's been an increase, what kinds of things you're hearing. We'd love to know. And whether you feel equipped to really support people in the way that you would like and included in the decision-making process at the moment. We're not going to be having any formal presentations today, but we are very, very lucky to be joined by some people from the health agencies who have responsibility for decision making in various areas who are here to really listen to what you have to say. So we have Emma Easton, who's the head of voluntary partnerships at NHS England, who'll be sharing some updates about that scheme towards the end of the webinar. We have Kate Foster, who is the deputy director for the COVID-19 shielding policy in the Department of Health and Social Care. We have Robert Edmonds, who I understand is going to be dipping in and out because he's simultaneously managing a focus group. He's from Public Participation Programme at NHS England. Now, we're really, really grateful that they are so generously giving of their time amongst their busy schedules to be here today to listen to what everyone has to say. Now, we're thrilled about the level of interest and that there are more than 150 of you joining us today. But we want to make sure this is as interactive and inclusive an experience for you as possible. So the bulk of this webinar is going to be dedicated to a guided discussion, both orally here and also in the chat sidebar. If you don't have a chance to say what you want today, fear not. There is an easy way for you to share your thoughts with us via a platform that we have set up called Our COVID Voices, and I'll tell you a bit about how you can do that at the end. But before we launch into the facilitated discussion, I want to hand over to my colleague, our communications officer, Sam Beatty, who's just going to talk you through the tech to make sure that this webinar really is accessible and easy for you to use. And then I'll give you a quick run through of the structure of the webinar. Thanks so much, Sam.
Thanks, Rebecca. If you could move on the slides, that'd be great. Yeah, hi everyone. So just to start off, we are recording this today and it will be available on our YouTube channel later today, so you can watch it back. If you could move on to the next slide, please, Rebecca. I'll keep this tech introduction very brief, but if you haven't used Teams before, you've got your icons on the bottom here that can control your camera and your microphone. Just to say quickly, if you, I think we've said already, if you could keep yourself on mute when you're not speaking, that'd be great. This is just to reduce feedback because we are expecting in and around about 100 people on this webinar today. But when the time comes, we all want you to contribute verbally as we can, so when appropriate. As many of you already done, can you please launch the chat, which is the speech icon? Please introduce yourself, and this is where most of the contribution is going to be happening today. If you need live captions, you can switch that on. That is through the more options, which is the 3 dots, and then you say turn on live captions. Next slide, please, Rebecca. As I said, yes, please launch the chat. This is also where we're going to be launching some polls today, so you'll be able to vote on a couple of things. And if you would like to speak, we have said please raise your hand there. That's a bit misleading. What we're going to be doing today is that if you make a good comment and you want to expand on it a little bit more, please say so in the chat, and me and Ella will inform Rebecca and Rachel, and hopefully we'll give you a slot. But as I say, we can't guarantee everyone a speaking slot today because there are a lot of people logging on. But back to you, Rebecca.
Thanks so much, Sam. So here's just a quick overview of what we're going to be doing. You've already heard my brief introduction, Sam's tech explanation. I'm going to hand over in a moment to my colleague Rachel, who is going to explain how she's going to be facilitating the main discussion, which is going to be around these 3 questions: how you're experiencing the lifting of lockdown, what you think could be done better in the future, and one thing that you'd like decision makers to know now. So those are sort of the 3 questions just to keep in your minds as we go through. After that, we'll have a bit of time for the people who have this decision-making responsibility from NHS England and the Department of Health and Social Care to share any reflections they might have with us about what they've heard and what they might be thinking of taking away with them from this session. Then we'll have an update from Emma Easton about the NHS Volunteer Responders scheme, and then a wrap up from me again, and I'll tell you about our COVID voices and how you can continue sharing your thoughts and feelings about what's going on with us. So without further ado, I'm going to hand over to Rachel Matthews.
Hello, good morning everybody, and thank you so much for joining us today. I can see so many people joining the meeting, and just to say thank you to Sam and Ella and Rebecca in advance, because this is probably our biggest webinar so far, so I'm probably the closest I'm going to get to be a talk show host to try and bring people in. So if we could just, again, we're just going to focus now into the interactive conversation, and as Rebecca has mentioned, we have 3 questions. So just to reiterate, just keep sharing your thoughts and insights and questions in the chat, and I know that Sam and Ella are really monitoring that like hawks. We'll be introducing some polls, and yeah, let's just see where we get to, and it will all be recorded and captured, which even if we can't attend to everything in the next 60 odd minutes, we could be able to come back to it at later stages as well. So if we could move to the next slide. So just in terms of trying to make the most of this really interactive opportunity, just to try and listen and chat respectfully, both verbally and in the writing. Really encouraging people to think about the ideas and not just necessarily focusing on individuals, and trying to be as concise as possible, which I know is difficult. There's lots that people want to say, so you know, it's fine if you need to get that down, but if we want to get as many different views as possible, let's try and keep the points set to the central point you want to make. So moving on then, the first question, and before we move to the response to the first question, I just want to draw attention to the wonderful photographs by Anna, who's taken these during lockdown, and I'm sure many of you will recognise similar types of scenes and images if you've been stuck inside during this period. So hopefully that will prompt a few thoughts as well. So let's start off then with the first question. How are you experiencing the lifting of lockdown?
Rachel, sorry. Where is the chat? Because I still can't find the chat.
Okay. Oh, hi, Kirit. If you do you have your bar in front of you? Can you see on the screen? If you click, there's a little speech bubble. Can you see the little speech bubble?
No.
Okay. Okay, I'm going to direct Sam to
Rachel, that. Just let everyone know, there should be 3 dots on the bar at the bottom of the screen. If you click the 3 dots, there will be a conversation with a speech mark next to it. You can either hide the conversation or show the conversation, and that will be where most of the contributions will be, and there'll also be polls. So keep an eye on the chat. Thank you.
Okay, so I can see some things coming up in the chat here now, and I'm just wondering if anybody is particularly keen to speak to those of us who are present today. If you could just very clearly say in your chat, yes, I'd like to speak to the group, that would be really helpful. So I can see some comments from Jessie, Paul, Lucy. Anybody wanting to say something?
Hello, sorry to interrupt you. This is Deb Troops, chair of the GMNA. I haven't got the chat bubble either. I'm doing this via a Mac. It doesn't like Microsoft Teams, and I can't see any way of accessing the chat. Not through the 3 dots, not on the bar, not anywhere.
Okay, Deb, thank you for drawing that to our attention. Can I ask Sam or Ella just to maybe just communicate with you directly?
Thank you. Do it over email if you could, that'd be great. Thank you.
Thank you. Thanks for drawing it to our attention. Okay, I'm just anybody wanting to speak. Just this is where we need to just have our slight coordination going on here. So, or are people keen to do it in the chat there? Anybody like to talk? Okay, we're getting some.
I've put a comment in here. It seems few people are having trouble with the poll, that you can't actually submit a vote because it's saying that it's not able to access the app.
Okay, so if that's in relation to the poll, let's just part that from in terms of just anybody wanting to speak about any of the issues about experiencing the lifting of lockdown. Let's just focus on anybody who would like to talk. That'd be great.
Someone from Age UK earlier mentioned that a statistic about a lot of elderly people not knowing whether they should be shielding or not. I think it was that 70. I think that was Meg Stapleton. 70% of people over 70, I think she said, think they should be still be shielding.
Hello, hi, it's Meg from Independent Age actually.
Okay.
Yeah, that's just to. I wasn't sure if it was relevant for this section, but yeah, we recently ran some nationally representative polling with older people, where we asked could they correctly identify what the current government guidance was for healthy people over 70, and 43% incorrectly thought that healthy people over 70 need to shield. So we're quite concerned about this, about what that might mean for people who haven't been able to go out to get supplies, even though they can, they just think they can't, or what that means for impact on their mental health, loneliness, isolation, all those issues. So we're currently pushing for much clearer guidance from the government for all clinically vulnerable people over 70, whether they have to shield or whether they don't have underlying health conditions. And just the language that's being used is very clear. They're being advised to take particular care when social distancing. It's not particularly clear what that means. So we're currently pushing for a lot more clarity around that, and maybe some campaigns on broadcast media that kind of give clear real world examples around what particular care means.
Thank you very much, Meg. And I think the issue around the clarity of the language is really important. So thank you for raising that. I know there are a few people coming in. I've got a few names that are coming up for me. I've got Ben, I've got Ramsey, I've got Christine, I've got Kynwyn. So maybe we could start now to Ben. I think you said something, I don't know if you want to come in now, and I'm going to come to some of the other names I've just mentioned. So Ben, if you're still there. Ben. Oh, can
you hear me?
Yes, I can hear you. Is that you, Ben?
It is, yes. Sorry, I had the microphone on mute.
Far away, thank you.
Yes, sorry. I don't know if this is true for anyone else, but my head isn't working very well at the moment, so my apologies if I'm not being clear. Yes, so I guess I mean I've got some particular concerns or questions, but I guess the main thing I'm looking to take away from this is a kind of an action plan for myself of things of what I could do to you know, to I don't know what the word is. So I'm someone who's autistic and with long-term mental health difficulties, and I'm a governor at my local NHS trust, and I guess I'm just from this is what hoping to come away with a clear idea of what things I need to be getting my trust to be doing to be supporting people with long-term conditions during this period. Does that make sense?
It does. Thank you very much, Ben, and please don't apologise for how you might be feeling. I think a lot of this situation is taxing a lot of us, so I don't want you to apologise for how you're feeling. We may not be able to be very specific right now in this next 60 minutes, but I'm sure within our chat, and if you want to contact us afterwards, we may be able to give you some support around how to clarify some of the issues. I think it's difficult to pinpoint very specifics at the moment, as people are saying from the guidance. So if you could bear with us, but let's see if others might have some suggestions.
That's really kind. Thank you. I appreciate that.
Okay. I had Ramsey, I think it was earlier on, and Christine, Morgan and Kynwyn is a sort of, and then I'm going to take another batch together. So Ramsey, are you still there?
Yes, I am. Can everyone hear me?
Okay. Yep. Far away.
Brilliant. So yeah, Ramsey from Carers Trust here. We look after the interests of unpaid carers. I think as lockdown does ease for the majority of the population, as well as sort of looking at the vulnerable groups that have been sort of set out, it's also really important to bear in mind that they've got unpaid carers who have to do a really difficult balance. So there'll be parent carers who don't know whether to send their children back to school, who might be looking after one disabled child and then the non-disabled child. Do they give, do they take that risk and put the kid back to school? In terms of returning to work, so as employers may think, oh, the lockdown's easing for everyone, but the carer might be shielding for very, very understandable reasons, and sort of balancing that relationship out needs to be considered, as well as just really simple things like going to the supermarket. We know supermarkets have taken certain measures, but actually vulnerable groups and their carers still need priority as this sort of moves on, because actually they are going to still need to be protected from a potential second wave. They are still going to be effectively in lockdown. So I think as the general population possibly eases in lockdown, there needs to be a real focus on the vulnerable groups as well as their carers.
Okay, thank you very much, Ramsey, and thank you for illustrating the complexity of the decision making that people are having to wrestle with, in terms of not everybody's wearing a single hat, they may be wearing more than one hat. So again, it's not straightforward, so appreciate you sharing that with us. I think I had Christine Morgan next. Is Christine still there?
Yes, I'm still here. Thank you. Thanks for the opportunity. For me, the big one, all of us, but for me, it's actually where is communication coming from? Because I mean, the time we were told that oh yes, you can go outside now. I'm in the shielding category, and that came by social media, then the newspapers before.
Christine, you're just breaking up a little bit there now. We just heard a little bit about the social media. You said about the information coming that way. Do you want to just expand from there?
Yeah, it's about where this communication is coming from, what's to be trusted, where can I find information. I've searched the web. I'm pretty good on tech and the web and know where.
Okay.
So it's just, for me, that communication is not good enough. If somebody's going to tell me something that is potentially life-threatening for me, I'd actually like some individual, I'd like that either to be a text or a letter. That's what I got initially. I've heard nothing since from anybody, and I just don't think that.
Okay, Christine, you're just breaking up. So can I thank you so much for those points. Those are very, very clear, and I think a lot of people will probably echo that the social media, the fact that you have to search for information, is not necessarily personalised. I think a lot of people would recognise that, and I'm sure others will maybe expand that point. So thank you so much for telling us your experience there, and also for giving some useful suggestions about how this could be done differently. So thank you for that. I'm going to move to somebody else now. So Kynwyn, I think you were next in my list, and then I'm going to look to Ella to bring in any more people, and then we may be thinking about moving to our second question shortly. So Kynwyn, if you're still there.
Yeah, hi Rachel, can you hear me?
Yes, can hear you fine.
Great.
Thank you.
Hi.
Yeah.
So I'm a director at Shine Cancer Support, so we support people across the country with cancer. I myself have an immune deficiency as a result of cancer treatment, so I've been told I should shield. I mean, there's 3 points for me that are really important. One is, I think, I felt like the shielding advice was basically aimed, at disabled and old people that the government didn't really care about. Like, they thought we had nothing to contribute. So it was just sort of stay locked in your house for 12 weeks and it doesn't really matter. A lot of the people that we work with are working. They have young children, and it's been a lot of confusion about, well, how do you shield if you have children that need to get out of the house? So we're hearing from people, sometimes you have children who have not left the house in 10, 12 weeks. And obviously that has implications for the children's mental and physical health. I think the shielding guidance was really blunt. It was a blunt tool just sent to everybody, which sort of assumed that there were nationally agreed criteria for who was vulnerable, and it caused a lot of confusion in our communities because some people had maybe finished cancer 2 years ago and they got a letter saying they should shield. Other people finished 6 weeks ago and hadn't received the letter, and I don't think enough was done to help oncologists, hematologists, GPs really get in touch with people and help them assess their own situation. And then the final thing I think for me is really that we need to have a grown-up conversation about assessing risk. Because they've basically gone from saying stay in your house for 12 weeks to it's fine to go out of your house and meet one other person outside for 10 minutes. But actually, would it be safe for people to go out early in the morning and walk around the block by themselves just to get some fresh air and see something different? And that's, I just don't think that they've really taken into account the impact that this has had on people. And even for myself, I mean, my husband is an epidemiologist, so I sort of have I've got a personal epidemiologist assessing my risk. So I have been going out running, not talking to anyone, not touching anything. But I get really anxious if I think, oh God, I gotta, someone's invited me to have a picnic in the park. Do I go? What would that mean? And I think I'm fairly robust, but I just think no one's really thinking about the long-term implications of all of this. So we need to have a really much more nuanced understanding of what the actual risks of different activities are for people.
Great, thank you very much, Kynwyn. And I think, again, you've reinforced some of the points that have been made around the bluntness of the communication, but also about how do we manage risk, because this virus is not going away, and therefore we all need to become a little bit more, we are having to think about lots of different situations, but we need the information on which to base that assessment in terms of what's happening with the virus, what's happening with services and our own individual circumstances. So it's unlikely to be a single message, is it? So there's this personalisation opportunity. So thank you for that, Kynwyn. I'm just going to see if there's a few more to take for this question, and then I'm looking to Sam, Ella and Rebecca to nudge me if we need to move to the second question. Any little bunches of people ready for any more responses? Ella, I'm thinking.
Hi Rachel, just to say everyone is doing a great job of participating in the chat. It's quite difficult to keep track of. I think Tom from the NHS made a really interesting comment about people who have other health and social care needs. I don't know, would he like to speak? Expand on his point about, I'm trying to just go back, I'll just go back to his message.
Yes, thank you very much. Ella, thank you very much. So it was a point that was raised by a member of our Learning Disability and Autism Advisory Group, although not specifically about autistic people, although that is his network. But what he noted was that there's a lot of concern about how the shielding lists were identified, and the fact that many people who are at quite high risk, perhaps, of impacts from the current situation in lots of ways were missed because they didn't fit the criteria of pre-existing physical or mental health conditions, but actually where there are sort of wider recognition of risk and of impact, for instance, on some autistic people, it would have been very helpful. There are a number of people he knows in his network who were unable to get essential support with things like shopping and things like that because they didn't count as being vulnerable and at risk because they didn't have the pre-existing health conditions, but are inherently very vulnerable for lots of other reasons.
Thank you very much, Thomas. And again, I think the sort of the use of these terms, vulnerable, what do they really mean? Do people want to be? The use of labels and language is quite interesting as to who falls in, who falls out of those. So thank you for sharing that point. I saw Carol Munt. I think you wanted to speak. Unless Ella, was there anybody else you had in the wings waiting?
Kirit, who isn't able to be on the chat, has sent an email saying he's got a few points he would like to make when there's a moment.
Okay, I'll go to Carol and then we'll come back to that person. And then I'm just, how are we doing on time? Do we need to move to the second question in a few minutes? We're doing okay?
Yeah, let's move to the second question.
Okay, let me just take Carol and that other person, and then we will move to the second question. Carol, are you still there?
Am I muted?
You're not muted. You can speak if you'd like to.
Yes, please. I think what concerns me more than, apart from the fact that everything seems to be internet based or digitally enabled, and there are an awful lot of people, as I said earlier, who don't have access, or either because they don't have the money to pay for broadband or for laptops or whatever, or because they don't actually want to use them, or because they don't know how to, and we're not really taking that into account. There are a number of things that I think are dividing people, making it much more difficult for them to access or to know exactly where they stand. I've got a long-term condition. I'm 75 years old. I haven't had any really useful communication, written or otherwise. So it's almost as if there's the earlier comment about the elderly, and I don't consider myself elderly, but unfortunately the NHS do. So it's almost as if we've been left to get on with it. And I do object to the fact that everybody of a certain age is being lumped into a group. I've got a lot to offer, and I'm not able to get out and offer anything. So that to me seems rather stupid. The other thing that worries me is the lack of real information that's coming across as far as masks are concerned. All of this sort of debate about whether they're useful or not useful, should we wear them, shouldn't we wear them, and then now we're being told that as of in a week's time everybody's got to wear masks on the Interrail and on the Underground and on any public transport. Why have we got to wait for a week? Why isn't it, if it's, people are going to think, well, it can't be that important, or it would have been immediate. There hasn't really been enough information about what sort of mask. I mean, I've had people ringing me up, Carol, or emailing me, asking.
I wonder if I could just, I'm sorry to interrupt you.
No, that's fine.
But some of the points that you're making may come into our next questions about what can we begin to do. So I'm so sorry, I can't take everybody, and just the coordination, you know, we're just trying to do our best to get as many voices. So, but thank you for the points that you've made. And let's move into, I think this is probably a good point to move into the next question, which is what could be done better in the future. So there's been a few suggestions around the quality of information, the source of information, preparation as things get changed. So again, we're looking to the chat here now. Is anybody would like to say something about what could be done better? Because I think this is where we need to direct our efforts now. So anybody coming through there? Let me just see. Ella, can you help me out with anything if there's anybody who's springing to mind? Oh, I've got James here. James Moore, happy to speak. James, are you able to have a go?
Hello there. Hi. Thanks for letting me speak. And yeah, following on from some really interesting points made. I'm a social prescriber and a community builder. So a lot of the work that I do is supporting communities, finding out how responses are going, and basically drawing attention to the fantastic efforts that are made. And I think with regards to your question, I really want to see and think about what has worked well during the crisis and what hasn't worked so well. And I guess this kind of links in with the first question. And I have this question around centralisation, because it seems like in the crisis there has been a fantastic response from communities supporting neighbours. And I think that can give a real sense of confidence, coherent messaging to people who are shielding and who are vulnerable by being looked after and taken care of by their local community. And, you know, whereas centralised systems such as prescription deliveries and communication, as we've seen, are really falling, they're just not hitting the mark. It is interesting to me to hear how, you know, maybe we need more hyper-localism, and maybe centralisation isn't working, and maybe we can learn from the stories that, you know, where we've seen neighbours proactively supporting each other, even if they're shielding, their gifts are worthwhile through, you know, calls to people who may be lonely, etc. But I think that may also contribute towards the future for what the challenges may be for those who may have spent a long time shielding and are now very precarious about maybe moving out of the home once things are more settled, so to speak.
Okay, thank you very much, James. And you make some really valuable points there about what could this look like in the future, and actually what can we learn from what's going well. So that sense of appreciation, this is how we can build from what's worked. And also the balance between centralised messaging and very localised messaging in terms of, again, the point that Kynwyn made about risk management. Do we know what's happening in our local area as opposed to what's happening nationally? So thank you. Those are really good points for us to think about as we move into the next stage of this pandemic. I've got George, I think, George Stanbury. I think, are you there, George? Would you like to say something?
Yeah, hi. So I think kind of moving forward, I think there's a couple of things that are really important. The first, and I don't think there's necessarily been enough recognition of this, is people who are kind of clinically vulnerable but not necessarily advised to shield, but are behaving in a way as if they were shielding, and actually means that they might be falling through support gaps. And so I think going forward, there needs to be a recognition that people might actually be really quite scared, or because they might have diabetes, which, you know, there have been some quite shocking stats about that in the news recently, might not be kind of going out and about when maybe they could be advised to, and how we can support people there. But then also for those people, and just more generally, you know, we know as the NHS is kind of returning back to normal, particularly things like mental health care are really important in thinking about how we can provide that support to people who have gone through, you know, what is quite an emotionally distressing time, not being able to go out and about or see people. We know that kind of speaking to some IAPT services, for example, that people with long-term conditions are really quite likely to, there's an increased proportion of people asking for kind of mental health support at the same time as staff are being kind of pulled to man other things. And so we really need to have kind of really clear information as charities and as people about what kind of support and services are out there as we're moving towards kind of normality, I think.
Okay, thank you, George. So it sounds to me like this sense of coordination of information so that people can begin to prepare for the next stage. I saw something from Asmina talking about how do we bring things together about different types of services. Asmina, I don't know if you were able to or want to speak. If you don't, that's fine. There's something in the chat that you, but if you'd like to, there's an opportunity to.
Yeah, sure, Rachel. Thank you so much. I think we really do need to talk to each other. Like our postman says to me, I know everybody here, and he calls me by my first name, and he found a lady who was not picking up her post. So I said, what are you going to do about that? He says, I will go and talk to my manager, who will go and talk to social services, and so we will get her sorted out. But the posties are not involved in anything. The police are. We talk to the police quite a lot. Social care, fight groups, voluntary groups, they are all absolutely amazing at the moment. And of course, we as patients need to be catered for as well. So it's how do you bring everything together? Thank you.
Thank you, Asmina. That's a really good point. I think you very nicely illustrate the informal networks that sort of happen in local areas between postmen and local shopkeepers, for example. And there's something about how could the government understand that picture more, and how we can sort of formalise that. Maybe it goes back to the point that others were making about this balance between the centralisation and local responses. I know I live in Tower Hamlets, and we get regular information from our borough. So it's interesting to compare across different areas of the country as to how well that's working. So just being focused on what could be done better in the future. Anybody else with any sort of pithy remarks you'd like to make about what could be done better in the future? Ella, do you have any other people who are waiting to come in?
Melissa made a good point about funding. I think everything everyone has said has really raised that the voluntary sector has been more important than ever during this time, and that this time has really highlighted how crucial the voluntary sector and our local communities are when crises like this happen. So I don't know if Melissa would like to expand on that, or if I was just highlighting that.
Is there a chance that I could contribute, please? I can't get on the chat. This is Deb Troops from Greater Manchester Neuro Alliance again. But if it's possible, I would like to just make a comment.
Yes, Deb, if you would like to go ahead, and then I just don't want to lose sight of Melissa, and there was also Sam Freeman Carney. So I'll come to, so Deb, you want to make your point, and then I'll do Melissa and Sam.
I'll be very brief. The Greater Manchester Neuro Alliance is a very small organisation, but we are part of the Neurological Alliance, and I'm sure you know that many of our community were not asked to shield, and they should have been. We are picking up the pieces of that. And if I tell you that our organisation, the traffic to our website went up by 400% in the first week. Now, it's died off a little bit now, but that's good. That means that people are feeling that they are supported and they're getting the information they need. The point I would make about going forward, and this is coming through the work we're doing through the Neurological Alliance, loud and clear, is that in the future, we must take seriously patient experience, not pay lip service to it, but listen and act on what patients, their carers, their families, their friends are telling us, because we have huge problems here in GM. We were supposed to be at the forefront of joined up health and social care. COVID has exposed the fact that what we knew was not working before certainly isn't now. We have people with their care packages reduced and withdrawn. We have people ending up in A&E who never should have gone back to A&E. And we have people who are very worried and very frightened because they don't understand what they're meant to be doing. So our proposal would be, in the first instance, if you're going to ask people to give you their experiences, don't just write it down, but act on it. Use it and act on it, because in the long term, you will be better informed and you will spend your money more wisely, NHS and local authorities. But also what we need to do, and what we are doing as a small organisation, is we are keeping our website up to date with only official information. And that has proved to be the case, that people trust us. They trust us. And that is a really quick way of making sure that our people feel better supported and better informed. And that's what we can do in the short term, I believe.
Thank you, Deb, and thank you for bringing to our attention the Manchester experience in terms of the devolution that's happened in the Northwest. Can I just ask you a very quick question? I take your point about the stories. How would you know as an organisation if you had been heard?
We actually publish on our website people's experiences just as they are. Now, we do not expose anybody to getting into trouble legally, and we don't take everything on absolute merit. However, if we get half a dozen stories and they all have a similar vein, we know then there's a problem.
Okay.
So that's what we do. We feed it to the various groups that we sit on. We're members of the Major Trauma and Critical Care. We're members of the Neuro Rehab Network. We obviously feed to the Neurological Alliance. We share on our Twitter, because our Twitter, although we don't get many retweets, we certainly have an awful lot of people who follow us and look at what we do. And social media has been very useful. But I take the point that the lady was saying about people who don't have the internet and can't access information online. My mum is 70 years old, living with a brain tumour in Lincolnshire. She has had no communication from anyone at all, not primary care and certainly not from the hospital. She has had all her information from me. She has a brick for a phone and she wouldn't use the internet even if I bought it for her. So we certainly need to address that.
Okay, thank you, Deb. Thank you for expanding that point. Again, I'm so sorry to keep having to move us on, but that actually really takes us to the next question in terms of have we been heard. So is there one thing that you would like decision makers to know? I think it was Sam and Melissa. I was going to come back to in the previous question, but I don't know whether there's anything you want to say that you could direct to this question as well. One thing you'd like decision makers to know.
Hi, it's Sam.
Okay, far away, Sam. Yeah.
So I say that I guess the one thing we'd like decision makers to know is that people are confused about what they should be doing. There's a lot of anxiety about what they should be doing after the end of June, when the initial 12-week period or shielding ends. And I think the previous point I was going to make, I'll make quickly as well, is that we've had huge increases in calls to our helpline around anxiety and mental health issues, and we've also just had the preliminary results from a survey of people with Parkinson's we're doing with the University of Lancaster, and the vast, what I was really surprised by was the vast majority, I can't give the data yet 'cause it's not confirmed, but the vast majority were not being offered telephone or video appointments for mental health, and in fact they were actually getting more telephone and video appointments for physical elements of the condition. So yeah, I think that really needs to be addressed.
Okay, so again, that's obviously people are saying let's increase direction of traffic to helplines, which obviously has an impact on the capacity to deliver that, and also what's driving that anxiety may be coming from some of this messaging as well. Melissa, I think I had for the previous question, but is there anything you'd like to say in relation to this question? If not, I'm going to just try and get people in from onto the third question. Melissa, are you still there and want to speak?
I am still here, yes. Can you hear me?
I can hear you, yep, far away. If you could be brief and to the point, and then I'll try and take a few more people for the last question.
Yeah, of course. I think that it's, we were talking a bit about the link between mental and physical health, and I think from our perspective, there needs to be improved kind of communication between the sort of hospital care and the community care, and looking at how physical and mental health is so linked. We deliver counselling, and I think it's often seen as a sort of nice to have, but actually it can really help people in their recovery. So I think it's really important that those links are made, particularly now, particularly when we're trying to support people closer to home and all that sort of thing. So I think, yeah, more dialogue and more working together with local community organisations, so that there's that link between the tertiary hospitals and the community.
Lovely, thank you for that. And as National Voices are also doing some work around mental and physical health and the connection between the two, so there may be an offline conversation around that as well. So thank you.
Yeah, I'm involved in that, so yeah.
Great, okay, lovely. And Ella, have we got other people for that? We've got about less than 5 minutes left, I think.
Freddie from MS Society had a really interesting point in the chat.
Okay, Freddie, are you there? Would you like to speak?
Yeah, sure. Thanks very much. So just briefly, there was some joint organisation activity last week on kind of calls for there to be basically better advice and information for people who are vulnerable. So I think one thing I'd want decision makers to hear is quite simply put someone in charge of vulnerable people, the kind of vulnerable people's issues. And I don't like that term, but that's sort of what we're using. There needs to be, cross government, an advisory panel, a named lead minister, someone that will develop a real detailed strategy. Because as many of us have been saying on here, it isn't just about the pure science and your likelihood of catching the virus. It's all the trade-offs, as people have been saying, mental health, the anxiety. So I think we need some leadership, and it needs to involve patient groups and people with experiences of shielding and broader vulnerable groups from the start, as it should have done, really. I think a really specific point within that as well is I've heard from NHS England that they are developing guidance apparently on how vulnerable people can access healthcare safely. I haven't seen that come out yet, unless I'm mistaken, and I'm really, again, concerned that for a lot of the people talking about long-term conditions, how are they going to feel safe, and how are they actually going to be made safe if they do need to access that essential care? And it isn't really been discussed much, but things like physio, hands-on physio for some people is just so essential to them, their quality of life and their mobility, etc. And that's kind of not come into the equation very much yet.
Okay, thank you, Freddie, for summing up the issues very nicely in terms of the transparency, that it's very difficult to make decisions unless you're correctly informed and have information that you can trust. Thank you for raising the point about trade-offs as well. I was on a call the other night where we have to make that far more clear in terms of we will have to make some trade-offs. I know we're getting close to the end of this session, so I'm just going to say one more person to maybe speak before. I'm just going to be looking to Ella and Rebecca here that will be coming in with maybe some other things shortly. But anybody else? Ella, do you want to just orientate me?
Sorry, I've been patient, and I think it's Kirit here. I wanted to get a few things.
Sorry, Kirit. So yeah, far away, Kirit. Yeah. Hi,
so I'm Kirit Mystery. I run a South Asian Health Diabetes group and a charity in Leicester, but I also work in mental health for a BAME mental health charities. A few points, I think. One is, I think we've heard from Public Health England and DHSC and NHS England are talking a good talk around co-production, co-design, but certainly if we look at the recent public health report on BAME, disproportionality. That was a lot of stakeholder exercises, but no real engagement, co-production. That's the first thing. Secondly, in terms of pre-lockdown, all this communication in terms of targeting, particularly the communities that don't speak English, there was a lot. We put out a lot of messages to say we don't want translated materials. What we need is a helpline where they speak various languages that would be able to then, and then what happens 9 weeks later, we see that more and more deaths coming from Black and Asian minority communities. So clearly the message from those communities hasn't got to about lockdown, shielding. Me personally, I got 7 weeks later, I got an SMS from NHS saying I should be shielding, but nothing 7 weeks prior. So that's something that we need to get right in terms of the messaging. We need to get the co-production, and most importantly, I think it's fair to say, look, there is a lack of diversity in terms of patient-public involvement. I keep harping on about it. I've got colleagues on the call, Carol and Christine. I've been working with many years around getting more voices heard, and I think that's something that glad to be engaged with the voices on this new project. So we will get that diversity engagement. But I think messages back to DHSC, NHS. Clearly we've not got it right in terms of the communication to communities that don't speak English, and that doesn't mean about the younger generation, but also the older generation. And finally, in terms of mental health, we are going to be seeing a pandemic around mental health come in the next months to come, because people have been isolated. Certain communities have not been able to say goodbye to their loved ones because of cultural and whatever, and obviously with protocols which you can expect. But we are going to see a pandemic, and there's going to be need for more counselling support services, culturally sensitive as well, to be able to respond. And that's something that we need to get stakeholders to think about. Thank you very much.
Thank you, Kerry, and thank you for speaking so eloquently about a whole range of different issues, some of which we predate the pandemic in terms of BME and diversity that we need to address and has been absolutely put into sharp focus, and also some of the things that you think the mechanisms could be improved with. So I thank you for saying that point. I think that probably is a great place to finish that interactive part of the conversation. So I just want to thank everybody who has spoken. Apologise to those who maybe were not able to speak, but I hope you've been able to capture things in the chat. And I'm now looking to Ella and Rebecca to either just take over from me to come back to the next portion. So thank you very much.
Yeah, thank you to all of you for sharing, so openly and honestly, and, with really good justification, passionately. I found that quite emotional. I've got 4 sides of notes here. This is now time for some of the people who have responsibility for making some decisions to sort of share some of their reflections. But I just, want to sort of say, they don't necessarily have the power over some of the things that maybe we're quite fired up about. And it's really wonderful that they've taken the time out of their busy schedules today to come, to be here. They're here to listen and to reflect. But we have some of the people that I think should be here. This is your chance to sort of say what you've heard today that you perhaps didn't already know, or that's something you really feel that you want to take forward from this discussion. Now we have Emily Hough, who's the Director of Strategy at NHS England. Hopefully Kate Foster, who is Deputy Director for the COVID-19 shielding policy at the Department of Health and Social Care, possibly Mark Sayers as well, who job shares with her. And I'm not sure if Robert Edmonds from Public Participation at NHS England is here still. But if any of you want to sort of say anything now, you don't have to, but this is an opportunity for you to do so if you would like to.
Hi Rebecca, this is Kate Foster from DHSC. I'm really happy to say a few words. And firstly, thanks to you, National Voices, for organising this, and to everyone on the call for taking the time to share your experiences and perspectives today and to talk so openly and honestly. It's been really valuable for me, and I'm sure for others on the call, just to hear really directly, I think, from the experiences of both those who are shielding and those who are working to support those who are shielding, and absolutely commit to taking your thoughts away today and back into the department and to feed into how we work on the policy and process moving forward. I think across the comments there was lots of great feedback that really cut across really just the importance of communication So how we reach people and how we explain the changes, the policy, the guidance, and how we do that in a way that is understandable for the person who is reading that, who may be experiencing this very different from the people who are reading it at our end. And I think there were a set of messages around that and things that we should reflect on, and that we will think about how we can do much better. So I think some of those for me were the points around digital exclusion and the degree to which those were being experienced. So on our side, the need for us to think through much better how we're reaching those without access to the internet, or who don't want to use that as their sort of primary source for these type of messages, which feel really important and really personal. So how do we make sure that people feel that they are being directly communicated with on changes that are really significant for them? I think there was a chunk of stuff that was highlighted around the need for sort of just clearer messaging and clearer language. I thought the statistic, I think from Meg, on the over 70s and the 43% of older people, healthy old people over 70, think they need to shield, it is really stark, and that really suggests that there's a huge amount that we need to do to be much clearer to explain the sort of the thinking and guidance to that population. And I absolutely heard the point about the sort of sense of a lack of leadership for this group, and I'll take that back. And then there's the sort of nuance in the language that I think someone referenced to. So, you know, what do we really mean when we say take particularly care, we're socially distancing? And that it would really be appreciated if we can sort of break down some of that language so it's much more clear and specific. And for the shielded populations, if we can articulate different risks for different types of engagement. So I think people were talking about, you know, is there a real difference between going outside in the morning very early to meeting one person in the park, and how different are those things, to help people take a more informed judgment for themselves. So that's something that we'll look at. And very much heard Kierat's points towards the end about not wanting translated materials, but how do we communicate and really reach those people who don't speak English. And then I think there was a set of points that were made, and we've also heard many of these through other channels, and we're working on how we can clarify this. So the guidance to underpaid carers, to how do people access healthcare safely, and for those who are living in households where someone else is shielding and they have to make choices about returning to work, or children returning to school, or siblings going back to school, what really is the advice to those people? So that's something that the team are already working on, but we know there is a gap that we need to close on that. And then the final point, I think, that's just been really useful to hear through this conversation is the sort of the depths of the anxiety that people are experiencing, and how they've sort of experienced that most recent change about going outside, and the need both to do what we can on the guidance, which I've touched on already, but the importance of this balance and the considerations of emotional support and mental support, and really looking beyond physical care, and making sure that particularly as the sort of policy evolves, if it does in coming months, that we're really thinking through how we support people as they go through those changes associating with that policy. So again, just to wrap up, I really appreciate all your thoughts, and I absolutely commit to taking those back into the department. So thank you very much from me.
It's really, really great to hear, Kate. Thank you again for being here. Thank you for listening, obviously, so very attentively, and for making those commitments to take those back. And I'm sure that's really appreciated by the people who are joining us today. I'm just wondering, Emily, how are you on the call? Would you like to say anything?
Yeah, it's Emily here. So I would like to kind of reiterate Kate's thanks. I found it really useful to hear from so many people sort of the personal perspectives of experiences of both people who are shielding and people with wider vulnerabilities. As Kate said, it's really important that we continue to feed these findings into government as they make those decisions. And I think I've heard a lot about how we can continue to improve how we communicate with colleagues across the NHS, with clinicians, to help them support their patients better as well. So I think I won't kind of reiterate a lot of what Kate's said, I endorse her summary given time, but you know, we're kind of actively thinking about how we can do things differently going forward, supporting the government to think about that, building on the lessons that we have heard today, but also more broadly our experiences within the NHS. So I think it's safe to say that we have really appreciated your time to share and have heard what's been said today, and I hope that we will be able to put this forward and have a sort of a different experience going forward.
That's great. Thank you very much, Emily. Emma Easton, who heads up some voluntary programmes at NHS England, are you here to give us an update about the voluntary responders scheme?
I am. Thanks, Rebecca. I've just been reflecting on what people have been saying through the webinar today, and given we've got such a small amount of time left, one of the things I was going to suggest is maybe that we run a separate session on this rather than me try and take us over time, because I know people will have other meetings to go to. But I just and it feels a bit inappropriate to start talking about something else and not reflect back on what people have been saying. I just wanted to say thank you to you, National Voices, for this webinar, because actually often people in the NHS, in the Department of Health and other government departments are invited to come to these kind of things and speak. And actually what that means is, whilst we get some information across that we think is very important, we don't hear. And so actually it's been really helpful today to just hear and to sit back and listen and to think about what we can do differently as a result. So I'm not going to add any other thoughts to what other people have said because of time, but it's been really, really helpful. It's really made me sit and think about some of the things that we can do differently. So the programme that I had wanted to talk to you about today was NHS Volunteer Responders, which some of you will have heard of. It's a very practical support mechanism that we've put in place in an emergency situation, very, very quickly commissioned. We're testing a whole new way of volunteering through it, and I really would like to hear your reflections on that as well at some point, and also to be able to give you some information about how it works, so that if you are a charity that is working with different populations, or you're in the shielded population yourself and you need support, that you know how to access that. But rather than try and race through that in 30 seconds, I was thinking what I might do is speak to National Voices afterwards about how we can set something separate up, if that's okay.
Okay, yeah, I think that's probably sensible. Sorry that there hasn't been enough time.
No, don't worry, it's fine.
This session, and we'll definitely do that. So I just wanted to say a few things about our COVID Voices, which is a platform that we have set up here so that you can continue to share with us your thoughts, your feelings, reflections, anxieties, fears, whatever it is, at any point during, you know, this ongoing phase of the crisis and as lifting of lockdown is continued. So please feel free to post your story. You can write to us. We can help you to do this, make a video or write a written testimony, or you can do it yourself directly. So go to ourcovidvoices.co.uk. Future webinars. So a lot of what's come up today has been about communication, access to information, a digital divide. That's what we're talking about 2 weeks today, is COVID-19 widening the digital divide. We're also going to be talking about the unequal impact of the crisis on mental health, community in a time of crisis, and sex and COVID, what are the gender dimensions of the crisis. So please make a note of those webinars coming up, and it'd be wonderful to have you join us again. Thank you again so much for contributing to the discussion today, openly and honestly, as I said. Special thanks to the busy folks at NHS England, Department of Health and Social Care, who joined us. We'll share a recording of the webinar with you so you can listen back. And please look out for some principles that we at National Voices have developed over the last few weeks. 5 principles that are basically responding to everything that you've said today, that are all about the need for a more considered, a more consensual approach to policy making, that is all about true co-production, and that really centres people and the people that are caring for them, their families, paid and unpaid carers alike, in changes that are being made. And finally, have a really lovely, restful, restorative weekend. And thanks to all my team who've done such an amazing job today in making this webinar possible. So thanks all. Bye bye.